Hi, welcome to the Watch and Whisper channel where if I'm interested, I'm talking about it. Well, I'm talking about Dr. Death, which comes on the Peacock channel. Today we're going to talk about episode 5. I'm just going to hit on some of the high points and then, give me some comments in my comment section. Let me know if you've been watching the series and also if you like it. And please consider subscribing and sharing my videos out. Well, the scene starts where they're at Baylor in Plano, and the administrator of the hospital is walking around with, I'm assuming, board members in the hospital, and she's just talking about the different things that they're doing in the hospital. And she runs into Dr. Death, Dr. Dunce. She runs into him and she introduced them to Dr. Dunce, pretty much telling him he's up and coming. He's like the next big thing when it comes to neurosurgery. Well, from there, the scene cuts over to the operating room, and it's Dr. Dunce, and he's in there with Kim, and they're both just talking about some supplies they're going to be ordering, but ordering for his clinic. Well, in walks Dr. Kirby. So he and Dr. Kirby are both scrubbing in the same area. And they have a banter going back and forth, but it really is Dr. Kirby throwing shade all day long at Dr. Dunce because he knows what he's really about. So from there, Dr. K um, took the opportunity just to continue to throw tons of shade at Dr. Dunce. And Dr. Dunce, took it all in stride, but he actually told Dr. Kirby, pretty much, you're going to be my assistant. Well, that didn't go over well. Where it cuts to the district attorney's office, and this is where you're going to see where the entire series is going to start taking a turn. It cuts to the district attorney's office, and this is where we're going to be introduced to the ADA, and her name is Michelle Sugart or Shugart. I'm looking at my notes because I took quite a few notes for this particular episode. The district attorney had already previously had a conversation with Dr. Henderson and Dr. Kirby. They went in and talked to him and was trying to see was there something they can do to actually file charges on Dr. Dunce for what he had been doing to his patients, pretty much killing them. Yep, a lot of them were dead. Well, they were talking to the district attorney, and the district attorney was just real cantankerous, and he just didn't feel like it was enough evidence for him to take the trial to court for criminal charges. However, he did think that the family members or someone should consider filing a civil suit against Dr. Dunce because he felt like a civil suit would have a better outcome and not a criminal case. Well, Dr. Shugart, I'm not Dr. Shugart, Michelle Shugart or Sugart, she's the assistant district attorney. She and some other assistant district attorneys was listening to what the two doctors had to say. Where it cuts back to where the district attorney and Michelle were talking about the case, and she pretty much told him, you know what, I feel like I can do something with this case. What they were saying just really uh, is interesting to me, talking to about the two physicians, Dr. Kirby and Dr. Henderson. She said, I really feel like I can do something with this case. Please let me do it. And he said, I just don't think this is a good case because he just doesn't feel like he's going to win. Most district attorneys wants to take cases that they feel like they have a strong probability of winning. Well, he said, you know what? You're the youngest DA in this office. You're just the youngest assistant DA in this office, in the history of this office. She said, you know what? And I could be the youngest assistant DA to leave. Pretty much telling him, I can do this. I can bring this trial to court and possibly win, but you have to believe in me. I believe in myself. Well, he said, you know what? Here, because Dr. Kirby has been calling my phone off the hook nonstop. So you go ahead and take it. And pretty much just telling her, this is your baby. You better make it work. Well, from there, it actually cuts over to Kirby talking to Dr. Henderson in Dr. Henderson's office. However, Dr. Kirby is sitting there with his foot on top of Dr. Henderson's desk. And he's talking about Mount Everest. As the story goes on, you hear about Dr. Kirby. One of his goals is to climb Mount Everest. So he's sitting up there with his foot, which is in a sock, but it's on top of Dr. Henderson's desk, and he's just talking about his foot. Dr. Henderson's face looked like, ooh, his feet stink. And then he made a little comment that made you believe that his foot stunk because he was saying, I have to sit in here and breathe this air all day long. So that lets you know that there was just a little humor in between the two, and his feet probably did stink. Who knows? But anyway, they started talking about Dr. Dunce. But as they were talking, there's a knock on the door, and in walks Michelle, the assistant district attorney. And she's telling them that she was there for their meeting. And so, they're looking like, okay, where's the district attorney? This is who we really want to be talking to. And she say, well, you have me today. So Kirby, with his old flip mouth, do we have you for today or we have you? She was like, you pretty much have me. Well, in his mind, he feel like she's probably young and inexperienced and probably wasn't going to win the case that they were trying to put together for Dr. Dunce. But they went ahead and listened to her and what she had to say. And she said that she was going to take the case and she was going to help them take down Dr. Dunce. Dr. Kirby was not impressed, and he just felt like she was inexperienced. So the scene cuts back to Dr. Dunce going into a hospital, and the hospital looks kind of really low budget. I mean, the worst hospital you can find, this is what this hospital looked like. Remember, the story bounces back and forth, back and forth. Dr. Dunce was told by the administrator from Baylor Plano that he would have to come with a patient roster before they could actually hire him in. Well, now we get to the patient that came to see him that had the motorcycle accident. And he was talking to the patient, and the patient just hated the service that he's receiving because he was there, had already gone through pre-op, and Dr. Dunce was walking in ready to perform surgery. Now, they showed Dr. Dunce walking in from off the street. He looked like he didn't even have a bath the night before or the morning of. He just looked dirty and nasty, and he just walked in the hospital, put on the doctor's lab jacket. So he's talking to the patient, and the patient is just telling him how unhappy he was